Hey guys, welcome back to Medical Mondays. In this module we're going to cover circulatory emergencies. Circulatory emergencies make up probably one of the biggest amount of calls that we go to. In this module we're going to review conditions such as myocardial infarctions, heart attacks, and cerebral vascular incidences, strokes. They are also your number 1, number 2 candidates to go into cardiac arrest, which we will cover in a later module. When we talk about cardiovascular disease, you'll notice in the diagram here, we're talking about the vessels and we're talking about the pump itself, the heart. In the actual diagram, you'll see that the arteries start to become narrowed. One of the conditions that we'll talk about that sometimes we'll respond to when the arteries become narrowed and people will exert themselves is a condition called angina. As these arteries continue to narrow, as you see in the middle diagram of the vessel and the farthest one, you'll see that they become completely blocked, which is also known as a heart attack, myocardial infarction. So in this chapter, we're going to be covering various types of cardiovascular diseases. And predominantly, they always affect the pump, which is the heart, or the blood vessels themselves. So let's take a look at cardiovascular disease risk factors. During our primary and secondary survey, once we've had a chance to introduce ourselves to our patients and we try to find out some history, some of these risk factors start to come apparent. Some of the uncontrolled risk factors are things such as gender. We know males have a more higher risk to have heart attacks than females, generally at a younger age. Family history, so asking questions like if there's a history of heart disease within the family. We know research shows us that there are strong links between cardiovascular disease and family history. And age. We know that generally as our age increases, our chances of cardiovascular disease increase as well. Controllable factors include things such as smoking, diet, high blood pressure, which is a vital sign that we established in the secondary survey, weight of the patient, and excessive exercise or lack of exercise. These are all contributing factors that should be taken into consideration when we're dealing with people with suspected cardiovascular disease. One of the most common emergencies that we'll respond to under the circulatory emergencies module is angina. Angina is a reduction of blood flow to the heart muscle itself. Chest pain, shortness of breath, pain in either arm, numbness in either arm, pain into the jaw area, various signs and symptoms similar to a heart attack are presented when people have these angina episodes. They generally label angina into 2 different types: stable angina and unstable angina. Stable angina is very predictable. If the arteries around a patient's heart are narrowed and the person exerts themselves, has a stressful event, heavy meal, it will generally bring on those symptoms. Hence why it's very important when we're asking our sample questions, part of our secondary survey, and we're specifically focusing on questions such as events prior, last meal, it's important to find out if there was any extra stress put on the heart itself. Another great acronym to remember when we're assessing chest pain and the possibility of angina is the OPQRST acronym, generally which is used, and we will cover in the secondary survey module, as a great assessment when we're focusing in on pain specifically in the chest area. Unstable angina is usually more unpredictable, and these are the individuals where we respond to and they wake up with this sudden chest pain that doesn't go away. Most people that have angina will carry a medication with them called nitroglycerin. Nitroglycerin is a vasodilator. Here at Berry Fire, we do not carry nitroglycerin on our trucks. However, it's very, very important if we ever find ourselves in a situation to assist people with nitroglycerin, or the individual themselves wants to take more nitroglycerin, that we first assess a good set of vitals, including blood pressure, because we know nitroglycerin will affect people's heart rates, and it will definitely affect the diameter of their arteries because it generally dilates the arteries to allow more blood to circulate to the heart. This will drop the blood pressure, which will notice obvious signs in a decrease in their blood pressure reading. One of the most serious things that can happen to the heart is a blockage of an artery. That is what we define as a myocardial infarction. A heart attack. A heart attack, or myocardial infarction, is when one of the arteries around the heart becomes completely blocked, and it prevents any further blood going to the heart muscle itself. The heart muscle itself will start to die. Because all the nerve ends around our hearts are different from individual to individual, gender to gender, it makes it very hard to predict what signs and symptoms these individuals will have. As you see to the right is a list of the more common signs and symptoms that individuals will have when they're experiencing a myocardial infarction. It's important to remember that not everyone will have all these signs and symptoms listed to the right. It's also important to note that this is your number one candidate to go into cardiac arrest. As more tissue dies around the heart muscle because of that blocked artery, the more likelihood the heart could stop contracting at any given time. These individuals should be closely monitored. We should be definitely placing them on oxygen, assessing their level of oxygen using the pulse oximeter on our defib, and assessing vitals, and being ready to hook up the defibrillator should they go into cardiac arrest. Some of the care for myocardial infarction. Early recognition. So doing a good primary survey and a secondary survey is crucial to recognizing the signs and symptoms of a possible myocardial infarction. It's important to update EMS. A lot of times these individuals will probably have to go to a cardiac center, especially if they're stable to make a transport to places such as South Lake Hospital. It's important to keep them in a nice resting position. Follow our ASA protocol under our medical directives. It's important also to make sure that we have the defib handy in case the individual does go into cardiac arrest. Remember our procedures for administering ASA and that we only give it to conscious individuals. Another condition that falls under circulatory emergencies is cerebral vascular accidents, or also known as a stroke. There's generally two main causes of strokes: a blockage of an artery leading into the brain area or a ruptured vessel in the brain area. It's also known as an aneurysm. It's very important to note that sometimes individuals will have blockages in some of these small vessels and arteries around the brain, and they might dissolve before we even arrive. This is also known as a transient ischemic attack, a TIA, very commonly referred to as a mini stroke. It's important when we arrive to these mini strokes or TIAs to do a good, thorough primary and secondary survey. It's also very helpful to talk if there's any bystanders that have possibly witnessed any stroke-like signs and symptoms. It's not uncommon that these individuals themselves can't remember the stroke incidences themselves. These individuals are prime candidates to have a full CVA or stroke. They must seek help. Sometimes it's very hard to assess vitals, and their vitals appear normal, but if they've had some sort of incident, it's encouraged these individuals do get transported to the local hospital. When caring for CVAs or TIAs, as you see to the right, we have some common things that we want to take into consideration. Remember, a lot of times with these individuals, there's paralysis, there's numbness. These individuals can be very scared having no usage of a specific side. So it's important to make sure that we position them in a comfortable position. Don't give them anything by mouth. You'll see to the right some great examples of some good key things to remember when we're caring for these individuals. Remain calm, because a lot of times these individuals are very scared. This is your number 2 candidate to go into cardiac arrest. So make sure you're doing a good set of vitals. You have the AED on standby in case they did go into cardiac arrest. When doing our secondary survey and we're assessing individuals for a possible CVA or a TIA, using the acronym FAST is a great acronym to focus in on specific effects, signs and symptoms of a possible CVA or a TIA. The acronym FAST stands for face, arm, speech, and time. Focusing on the face, individuals will have paralysis on one side, unable to use a certain group of muscles in the face. Arms, having the individual do simple things like holding their arms up and squeezing your hands, and also doing things like closing their eyes, could be a challenge for them if they have paralysis or weakness on that one side. Asking the individual to speak or smile, you can see that they are struggling with using that specific side affected by the CVA or TIA. The T stands for time. When signs and symptoms first appear, or the person is last to have known to have been well. It's important information, and a lot of stroke treatments work within certain time frames. This is great information to pass on to paramedics when's the last time they were seen without having possible CVA or TIA symptoms. Another great tool that's used in pre-hospital care when assessing for strokes is focusing in on 3 key things: facial drooping, arm weakness, and the speech abnormalities. Very similar to FAST, asking these individuals to do simple things like smile with showing their teeth is a struggle when they have paralysis of facial muscles. Having individuals like the acronym FAST hold their arms up and squeeze your hands with their eyes closed is a struggle, keeping both sides balanced with strength. Having the individual say simple things such as the early bird gets the worm using the finer facial muscles could also be a struggle. Remember, using these different types of techniques are great techniques part of your secondary survey when we're assessing for a possible CVA or a TIA. So there you go. In this module, we've covered various different types of circulatory emergencies. We've covered your number 1, number 2 candidates that go into cardiac arrest. In a later module, we'll review our cardiac arrest procedures in our medical directives and some common principles that you should be aware of. We'll see you in the next module.